I'm going to demonstrate 6 of the McKenzie techniques. So the first McKenzie technique that I'm going to demonstrate is the repeated extension in lying, and I'm going to do 3 times of this. So what the patient's going to do is they're going to place their hands under their shoulders, almost like they're in a press-up position as they're lying on their stomach. Then what they're going to do is they're going to use their hands to push up and extend their elbows. This is going to create an arch in their lower back, but the patient's always going to keep their pelvis on the bed. If the patient has a lot of extension in the lower back area, what the patient can do is just move their hands down slightly below their shoulders, and this will give more extension in the back. So we're going to do this 3 times. So that's 1, 2, good. Now as the patient's doing this, it's a very slow and controlled movement up and down. The second technique I'm going to do is the repeated extension in lying, but with therapist overpressure. So what I'm going to do is I'm going to place my hands in their lower back and move with the patient's movement. Okay, and we're going to do this 3 times. Good. The next one we're going to do is shift correction, so if I can ask the patient to get off the bed there. So this patient has a right-sided shift with their pain on their left-hand side. So what I'm going to do is I'm going to put my hands around their hips, almost like I'm going in for a rugby tackle. I'm going to use my shoulder and my head on their back. Go into a lunge position. Next one we're going to do, the patient's going to sit on the bed. This is called repeated retraction in sitting. So what I'm going to ask the patient to do is look at the wall in front of them. And they're going to imagine they have a pane of glass under their chin. Yep. What the patient's going to want to do is make a double chin as they pull their head back, not wanting to break that pane of glass. We're going to do this 3 times. Good. 1, 2, and 3. The next one we're going to do is repeated retraction extension in sitting. So it's exactly the same as the other one, except as the patient makes their double chin on the way back, I'm going to ask the patient to extend their neck and get their eyes to look at the ceiling. So if the patient retracts their neck, then brings their head back and eyes up to the ceiling, slowly and controlled. We'll do that 2 more times. Good. And once the patient moves their head back from that extension, it's in the neutral position. Good. The last McKenzie technique I'm going to do is retraction extension but in supine lying. So I'm going to get the patient to lie on their back. And we're going to ask the patient to do this 1 time. So what I want the patient to do is use their strongest hand and put it under their head for support. Then I'm going to ask the patient to shuffle up the bed so that their shoulders are in the same alignment as the edge of the bed. Good, that's you there. Now what I want the patient to do is retract that neck to make that double chin. And now as the patient extends their neck, you're going to release the support of the head and act as gravity to extend that neck. And once the patient gets to full extension, then they're going to remove their hand and then rest there for a couple of seconds. Now I'm going to get the patient to use the exact same hand and put it under their neck and head to support that. Bring the head back up nice and slowly and gently. Once the head is fully back into the neutral position, the patient can shuffle themselves up the bed again. And then if the patient relaxes there, and now I'll ask the patient to lie there for a couple of minutes just to relax.